Hello, everyone. My name is Joseph Isabel. I'm a student of UMass Global. This video is a summary of my clinical experience over the last 510 hours for both my psychiatric and psychotherapy rotations. Description of facilities and preceptors. I completed my clinical rotations at two facilities. The first place was a family psychiatric clinic in Sugar Land, Texas, and it's called the Sublime Behavioral and Wellness Clinic. It's in Sugar Land, Texas, under the preceptorship of Dr. Jibril Adediran, with many years of practice as a mental health nurse practitioner. The client that we see in this clinic from ages 10 to adulthood. The second place for my clinical rotation is called the Breakthrough Behavioral Clinic. It's in Bedford in Houston, Texas. And this was for my psychotherapy. And my preceptor name is Charles Liddell. Mr. Liddell has been practicing for the past 8 years. And in the clinic, we saw um, ages across the lifespan for psychotherapy. The best and the worst experience. The best experience was working along with my two psychiatrists, gaining knowledge on how to perform initial assessment, how to identify cues, and build on them. To gain more information from patients, the ability to understand cultural diversity, evaluate self beliefs, and incorporate cultural diversity into treatment. The identification of psychiatric disorder in patient's family and in relation to what patient is currently exhibiting. Formation of diagnosis, differential diagnosis, development of treatment, and implementation of evidence based practice. I also gained the knowledge by being receptive, listening to what patient has to say, and developing empathy towards patients, and the ability to be calm and listening attentively to patient and avoiding to be the center of attention or conversation. And I also gained the ability to redirect conversation back to patient, understanding rationale for a particular treatment plan and not others, understanding reason for a combination of psychotropic and psychotherapy treatment, and also reason why we start a psychotropic meds with a low dose and following up adjustment as needed. I also gained the knowledge of lifting family and patient, know when to stop a medication in terms of maybe side effect or an allergic reaction, and calling back on how to call back providers or go to the emergency room if need be. My worst experience. I did not experience any worst thing during my clinical rotation. Both preceptors are willing to teach. Both preceptors were very knowledgeable and they explain reason for diagnosis. They answer questions clearly and precisely. They were both very receptive and always willing to hear my opinions. They both communicate clearly and capture my attention. The experience was what I expected and gained more knowledge as psychiatric and mental health student. I was able to see patients alone. I was able to see patients alone. My preceptor allowed me to run sessions and briefings with diagnosis, treatment plans, and follow up. I did not I did not learn the business part of being a secretary of mental health practitioner from my preceptors because I wasn't involved in the billing department. I do understand some of the ICD codes though and the CPT billing codes, but no clue on reimbursement. Even though I am a family nurse practitioner, my ward is changing now to be a psychiatric and mental health nurse practitioner. And I am well prepared in diagnosing, differential diagnosing in mental health. I feel that my preceptor prepared me for what is ahead, and I think I'm ready for what is ahead. I am intrigued and wanting to know more to prepare for my practice. I am different now in my approach in patient care. I am now ready to put cultural differences into consideration during assessment, treatment plans, and implementation of care. What has changed about me is that now I am aware that people deal with emotions differently, and physical appearance cannot tell the whole picture about a patient until you start speaking with that patient. Now, I do not judge patients or have premature notions about them. My approach now with patient is different, and I cannot be judgmental or biased either, either based on race, gender, socioeconomic status, or religious affiliations. The population of patients I would like to work with has not changed, as I would like to work in the clinical settings and work with all ages from adolescence to adulthood. Yes, I would like to be a family mental health nurse practitioner. Overall, I believe that my clinical experience has prepared me for a successful future as a mental health nurse practitioner. Thank you very much. And a very big thank you to both Dr. Yos and Dr. Willis for impacting all this knowledge on me. God bless you and your family. Thank you so much.